At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting. All right, so it talks a little bit about Parul. She is the owner and vice president of the revenue cycle at PRACTICEFORCES, a local company out of Palm Harbor, Florida. Very, very bright, business leader.
So we can't, as we all know, March 2020 was the hit when pandemic started. And that was the time when CMS initiated and said telehealth is open for all physicians across the board. You can see patients from Florida. Florida providers can see patients in California. And because of the shortage, I think they opened everything. No rules are there yet to close it, and it looks like telehealth is here to stay. Of course, we are hearing about some telehealth attestation that government will be asking the providers to do attestation certification. So I'm sure if they stay, they will tighten the rules a little bit. Right now, telehealth is open. You can do it through FaceTime. Video call, audio call, everything is allowed, but I'm sure if they are leaving it open, they will tighten the rules more. I remember last year when they started the telehealth, how crazy everyone was. All medical practices were in a panic attack to figure out how to utilize technology, how to see patients, but not call them to the office. So it took almost a decade for Medicare to introduced telehealth, and pandemic was a time when it all kind of fall into place. So it's a boon. I have also heard from physicians, and Dr. Mahajan can share his experience as a physician. How do you like, Dr. Mahajan, telehealth? I guess it's like everything; it has its own good and bad.
Right. So the telehealth, I think, is very useful for, let's say, someone having cough and fever and you don't want to get them out of the house, especially in pandemic when you're not sure whether they have COVID-19 and you don't want to give it to any employees in the office or any other patients who's in the office. So that has worked well, but it has its limitation because not everyone has great cameras or great know-how to use the technology tools. And the sense you get from examining a patient in the office is a very unique sense, and it's hard to replicate that for a lot of conditions through the camera. So yes, it has its value, and I hope they keep it as another tool for something like simple like UTI, something cough and cold, something quick. But if they're having chest pain or chronic condition, lab follow-up, again, unless it's something not anything abnormal and you need to follow through on any testing in the office, that's again a good use of telehealth. I have some patients who come from Riverview, Brandon. I have a patient who comes from Fort Myers. So, and I have patients who are snowbirds, and now they are using it when they are going to Michigan or Illinois or Massachusetts or any place, so the distance has become immaterial. So, for refills, let's say, and they had the blood work done, they just need the refills. I think that's good for that. So, it has its pros and cons.
So in our office, we'll go ahead and send you a text message. So I'm just going to show you.
Before we do that, Jen, I know you're nervous and you want to get it out of your chest, but I want you to introduce Debbie, your boss first, properly.
Okay, so this is Debbie. She's the office manager here at Mahajan Medical Center. And you should know me. I'm Jen, and I'm one of the lead medical assistants back here. And I also work on the CCM program and case management.
I want to make an appointment with Debbie, for example. So I call the office and say, hey, I want to see Dr. Debbie today, right? And then you say, okay, I'll send you a link, correct?
Okay, yep.
Yes, okay. And then you send the link on there. Say, okay, you have a phone, so they need to have a smartphone or a phone which can take text, correct?
Correct.
And has a
Okay.
video
Has to
camera.
have a camera on it.
Right. So let's just talk basics here because a lot of senior folks struggle. So they need to have a camera, phone, and they can take text, correct? Because a lot
Yes.
of them have flip phones, so that won't work with flip phones.
No, unfortunately, that won't work.
Okay. So, folks, it's good to invest in a smartphone. If you want the televisits, or more importantly, if you want to look at your labs, which they're going to show you in a minute as well. So, smartphone with cameras are become very cheap now. You can get the older versions of the iPhones or the Android, whichever you prefer, and they're not as expensive as they were before. And once you use it, they are great for taking your selfies and sending it to your grandkids or whatever you want to do. So the smartphone is number one piece of equipment they need. And then you send them a text, hey, you're invited, and then you take over from there.
From our end, it looks like this. So we'll send you a text message from here. And then you'll see where Jen showed you that she received the text. Now Jen's in that waiting room. So we'll just click on her.
So Debbie has sent me a text message, and I just want to show you on here what it's going to look like when you get it on your phone. So we'll say Dr. Mahajan has invited you to join a video call. Very simple. So all you got to do is click the link, and it's going to bring you here to the Doxy website. Oops, sorry.
That's okay.
Okay, and then you're just going to check in. So that means you're just going to put your name in there so we know which patient you are. Okay, and then we're just going to hit check in. And then this will be the waiting room. So it says Dr. Mahajan's available. So then we're just going to wait for the doctor to get on.
Now we hit start call, and then it will connect us to her phone.
They still need to pay their co-payments, right?
Correct. They'll work you up just like they do, but instead of being at check-in where they collect your copay, then one of the MA girls will either bring you up front, collect your copay over the phone, and then we'll go from there, and they'll continue to work you up as if you were in the room with them.
So they need to have a form of payment if they have co-payment available through credit card, correct?
Correct.
Yes.
Okay. So it's very simple, and then minute we click OK, and they can see us and we can see them, correct?
Absolutely. And then it's very simple from there. And then it says the video session will start soon. So then on my end, I'll be able to see a picture of the doctor, the provider that I'm seeing.
So we got Dr. Debbie there. Huh?
I'm doing well, Debbie. Thanks for being able to fit me in today.
No problem.
And then Debbie will have a picture of the patient or you on her phone. So she'll be able to see if you have anything you wanted to show the doctor, a rash or something. He'll be able to see that. And we can also take pictures as well.
All right, Parul. So do you want to, so that's one way, and the other way is a direct FaceTime as well. And that's also considered televisit, correct?
Yeah, initially it was, and I think the government right now is not too crazy on the rules and stuff. We have not seen much audits on records for telehealth charts, but time will tell where it is going. Looks like it's here to stay. The insurance companies, especially CMS, is extending the telehealth every 90 days. So we'll see July 1 what is the new update coming forward. As the cases are going down, it looks like even though pandemic, I don't know if we'll come to an end or what, but telehealth will be there. I want to share a very important data. Before the pandemic, telehealth was allowed for rural facilities, and the data was in a week all over the country, about 10,000 patients were seen as telehealth. And since March 2020, every quarter, there are more than 10 million patients who are getting services via telehealth. So that's amazing, change using the technology. Yes, some patients are not as, like Dr. Mahajan was mentioning, the phones and stuff, but definitely the update that the providers have done, the patients have done, utilizing the technology for good, for medical reasons, have really seen a lot of changes in all countries around the world. People are now using telehealth.